Good morning, everyone. My name is Jennifer, and I am going to make a detailed video on having a dermoid cyst removed, ovarian dermoid cyst. I just recently had the surgery through my OB. I found out via going to the hospital a couple months back. Today is May 3rd. I was put in the hospital with stomach pains back on January 21st. I had just gotten back from a work trip and was on my period when I went on that trip. And towards the end of the trip, I just started feeling really kind of sick. Like my body just was hurting, and I just started having like a really weird period. And to kind of follow up with all of this, I only started feeling symptoms of the cyst probably maybe sometime last summer. I fully believe that the cyst has been there for a long time, and you fully can have a cyst in your body for a long time without you even really knowing it. Some people show symptoms, others don't. I started showing symptoms probably by about last summer. And I want to go over all of the details of this just because so many people are unaware of what happens when you have a dermoid cyst. And I watched so many YouTube videos, and a lot of information was either just not fully covered, or just a lot of things were still in question that I felt people had in the comments. So I definitely want this to be an informative video, and I'm pretty active on my YouTube channel. I don't upload very often, but if I get comments and stuff, I'm pretty active enough to where I will do the best that I can to answer questions. And obviously, I'm sure I have to disclose, I'm not a medical professional. I'm not a doctor by any means. These are just my thoughts and opinions, and really my overall experience with the surgery. So, and I apologize, I'm probably going to be all over the place with this video, but if anybody has any questions and if I miss something, please just message me and I'll do the best that I can to, answer your questions. So I went to the hospital back in January, and I was just, like I said, I had just recently come back from that trip. I couldn't really eat anything. I was having extreme hunger pains, but also extreme nausea, and I just didn't know why. At the same time, I was having a really hard time urinating. It just constantly felt like I was having a UTI or a bladder infection. And my bowel movements, I was having a lot of diarrhea within those past couple weeks, months. And all of those are symptoms of ovarian cysts, depending on the size. What I ended up having to do at the hospital was they did a CAT scan, and they said there's nothing wrong with your abdomen, but you do have an ovarian cyst that we can see, and you will just need to follow up with your OB regarding that. So the unfortunate thing was I had just lost my OB because she had left the practice that I was currently going to, so I had to find somebody new for this whole experience. So I was a little nervous about that because I didn't really have time to do a whole lot of research. I just needed to get this checked out, and also I was about to go on another work trip. So I was trying to get all of this figured out before I went again in case I needed something more immediate to happen. Like I kind of suspected maybe a surgery was going to be needed, but it was just way too soon to tell. So the week that I got out of the hospital, I was only there for one night. I didn't even get admitted. It was just a couple hours, They just said, there's no other complications, but this is probably why you're feeling this because it looks pretty close to your bladder, your stomach lining, things like that. And, once a cyst attaches to all of that, everything is affected, I found out. So it made perfect sense as to why I was feeling so crummy for the way that I was. Also, I want to say I have had really, really regular periods. Not a whole lot of discomfort flow-wise. Everything was pretty regular timing-wise. The biggest concern that's grown over the past couple months is, if I had to guess, like a couple days before you start your period, your body starts releasing the hormones. I don't remember what they're called. And that is the hormones that cause the intense cravings, your cramping, kind of things like that. Your hormones go crazy. You start, how your body feels. You feel kind of sick. You're always uncomfortable. I get personally very anxious, but the not being able to eat was the most oddest thing for me. Like, I was hungry, but I felt so sick when I ate, and I always felt full. And that is something that I also felt several months before. Like, I just constantly felt bloated and sick. I could be hungry and want to eat, but when I ate, I could take 2 bites of anything and feel sick. Like I just wouldn't want to eat the rest of the day. So it was very, very frustrating not realizing what that was. And before the whole cyst thing came about, I was about to go see a intestinal doctor to see if I have like IBS or something, because my metabolism, I'm 5'3", 130 pounds. I have a very high metabolism. Up until a couple years ago when I think the cyst developed, I used to be able to eat all day. I never had gut issues, never had bowel issues, none of that. So the cyst, I think, is 100% what made these problems come about. And also, they say that being on birth control causes the prevention of cysts, but honestly, I think I personally chose to get off of birth control for a lot of reasons. Hormonally, it was making me go crazy. A couple years ago, I started having hair fall out, and I was convinced that it was from my birth control. My doctor at the time in another state was like, no, I've never heard of that. And that is a very actually common symptom of birth control after having it in your system for a couple years. The only reason I really got on the birth control, obviously because first and foremost, I didn't want children at the time. And my husband and I actually chose not to have children. But it was also for acne control. I had horrible, horrible cystic acne all through my 20s. The only thing that cured the acne was the birth control. So I think really what the birth control did is just overall it drastically changed my hormone balance, and somehow I'm just under the impression, nobody can give me an answer on this, but I am under the impression that the second I came off the birth control, obviously your body it takes a couple months for your body to bounce back. I truly believe that in the changing months of those periods, something happened, and that's when the cyst started forming, and it turned into a dermoid cyst, which is a hard mass that can have hair and teeth inside of it. So, obviously, I found a new OB. I went to an appointment, and not even the actual doctor I had seen yet that day. Was just talking to the nurse practitioner and the ladies in the office who are like the tech. They just kind of answer all the questions, like, when was your last period, things like that. They answer those kind of questions, and both of them were like, wow, just looking at the information from the hospital, you're going to have surgery. This is a large cyst. And I was like, what? And they were like, yeah, we're sorry. I hate to be the one that tells you that. And I was like, well, I've got to see the doctor before I can get confirmation on that. But sure enough, I met with the doctor, and she was like, I can't tell you what to do with this. A lot of people can live with this cyst if they feel that it's not affecting them. But she was like, given the size of this, I recommend that you do get it taken out. She was like, it's gonna, change the way you're kind of like living your everyday life a little bit. And it was a 5-centimeter dermoid cyst. So 5 centimeters, I Googled, I think it's about the size of like a lime. I could be wrong, but at that point, I was greatly, greatly feeling it daily. I was just more in tune to what it was making my body feel like. I felt it throbbing quite often. I wasn't in really any pain. There were nights where I could feel it throbbing, and like it would ache for several hours at a time. I never really took stuff like ibuprofen just to because like I said, it wasn't really a pain. It was just like a dull presence. But as the months went on for the recent 2-3 months before up until my surgery, the 2 or 3 days before my period, I had started getting violently ill. I could not eat. I was throwing up. Again, same bladder issues, gastro, bowel issues, like things were just progressively getting worse. But after I saw my doctor and we made that appointment, she was like, I told her, she was like, again, it's totally your choice, but it is something that I recommend. And I ended up, deciding to go through with the surgery just because even though it was uncomfortable more or less just a couple days out of the month, I started feeling it daily. And just because of what it was making me do diet-wise, I was not losing weight, which is a common symptom if you're not able to eat throughout, with the cyst, just because of the problems that it can cause with your gut and things like that. I was not losing weight, but my clothes were not fitting me. And I have never been one to have, over the past couple of years, I've started bloating really bad when I eat anything. And I never had been like that before this. The time that I really am convinced that the cyst came around is when I really started having, like I said, gut, overall bloating issues, problems eating. So it was just, for reasons like that, I wasn't going to buy new clothes just because of that. And so it was a really tough decision to make because it wasn't entirely necessary. But for my overall health and affecting other organs, I decided to get the cyst removed. So I did have the surgery. It was 2 days ago. Currently, I am on day 3. This was also my very first surgery ever. I have never had anything surgical done. I was very, very scared up until the day of the surgery. I didn't know what to expect. So I started watching all kinds of YouTube videos. A lot of the information didn't really apply to this kind of surgery. A lot of other surgeries are just like endometriosis surgeries where they're removing things. And I guess overall those are the same kind of concept. Like they're going in there the same way. They're scraping. It's a laparoscopy surgery. So it was not too invasive. The healing process is going to be a whole lot better than anything else. But I went in Friday morning and I knew it was going to be a really quick surgery. So, you know, walking into the hospital, they check you in. Currently, we're in the middle of the COVID-19 thing too. They almost pushed the surgery back. So that was really, really, really frustrating because at that point, by Friday morning, I had so much anxiety. I was like, if you guys push my surgery back, I'm probably not going to handle this well, you know, and they understood. They were just like, you know, we just have to follow the state law. So, you know, it is what it is, but thank God it did not get moved. I think there were 2 surgeries that day. And they just decided to keep the surgeries. So I was so thankful. So anyways, I checked in that morning. The first thing they did was start my IV, which was very painful. I've never had an IV before, and y'all, that thing hurt. They do blood work because they have to make sure that you check out okay lab work wise, like your red and white blood cell counts, things like that. All of that is very important before you go into surgery. They have to check your heart, your lungs, things like that to make sure that you can handle the anesthesia while you're under. And the biggest thing for me was I had never had anesthesia. So I was very, very fearful of that because I've read things that like essentially you're put into a coma. You know, you can come up very disoriented. You might lose sense of things, your memory. I mean, that's a stretch though. The only side effect I had was extreme nausea. I woke up and just wanted to throw up everywhere. My head was throbbing. My eyes were rolling all over the place. I felt so sick, and that lasted the entire day. This is an outpatient surgery. Typically, you are expected to be out after surgery in 30 minutes. It took me 4 hours. I could not lift my head without vomiting. I was able to keep water down, but the overall nausea is what literally kept me in bed. And they were kind of like, you got to try. And I'm like, oh my gosh, there's nothing worse than being in pain and throwing up as well. Like it was just so foreign to me. It was really scary. They also will not let you leave the hospital until you urinate. And I had a very difficult time. When I went to the hospital the first time back in January, the IV fluids that they put in me went right through me. This time I had 3 bags of saline and I could not pee. I just didn't have to go. It was the weirdest thing. They also make you fast for 12 hours before the surgery. That was very, very difficult. I felt so nauseous when I walked into the hospital just because of how hungry I was. And I had begged the anesthesiologist to please, give me something for the nausea. And I have glaucoma. I have high pressure. And they said that a lot of the nausea medicine just does not mix well with it. So they really couldn't give me a whole lot, but they would try. But after the surgery, when I woke up, I was like, did you guys give me anything for nausea? I feel so sick. And they said, yeah, we gave you 2 of the strongest things that we can, and we can't give you any more. And I was like, oh my gosh, this isn't even touching it. So I was really shocked because I've never taken like hard medicine. So I really thought that it was going to work very, very well. The pain, I felt no pain, but I knew to not really expect the pain for the next day. She warned me also, anytime that you have surgeries like this, they have to fill you up with CO2 gas to blow up your organs so that they can see what they're doing. And one of the other really bad side effects is you will feel that gas throughout your chest and your stomach for several days. I did initially feel it. They said it would be in your right shoulder. Sure enough, it was there. It wasn't unbearable though. It just felt like a really bad muscle cramp. But like the second I got up, in between vomiting and trying to go to the bathroom, I was stretching my arm and that like immediately took it away. So, I mean, the second you start feeling it, you've got to stretch. That's the only thing that gets the gas pains away. So I finally went home. It took 4 hours for me to get out of there. And stitch-wise, she went through the bottom of my belly button and on either side of my hips. And she let me know you're going to feel pain probably the most in the central one because that's incision. It's probably about this long. It's really not terrible, but the other ones are very minimal. She gave me a list of instructions, how to keep things clean. I personally was given stitches under like a dab of glue. So it's like a kind of unprotected wound, but it's covered with the glue, so it's sterile. Day 1, when I got home, the first thing I did, I had to lay down. I had to try to get rid of this nausea. They said it was from the anesthesia and that it was going to last about 24 hours. And I was like, this has to go now. I couldn't open my eyes. I couldn't function. I knew I needed to try and eat something, and that wasn't going to happen. So I just went home and I took Dramamine, and Dramamine worked wonders. I only took one just because I knew I already had so much medicine in my body. I didn't want to overdo it and get sick. Dramamine worked. It took about an hour to work, and it worked wonders. So if anybody, doesn't go well with the nausea medication that they give you, I recommend just buying a pack of Dramamine tablets. They're like $3 at CVS, Walgreens, any of those places. That worked, and it took it away, and it never came back. I could still feel the anesthesia. I was still very kind of loopy and a little disoriented. In the breathing tube, once I got up and started talking, I was very raspy. I am still slightly raspy 3 days in, but my throat hurts because of the tube, but that's normal. It just kind of felt like a dull sore throat. Yesterday was day 2. I slept pretty well the night before. They gave me, for medication, they gave me hydrocodone and 800 milligrams of ibuprofen. I am just personally not somebody who wants to put a bunch of chemicals and bad medications in my body. I took 600 milligrams of ibuprofen just because the pain, just for me, it wasn't really pain. It's more sore and tenderness. To me, it feels like you had a tummy tuck. Everything across just feels really, really tight. It's sore, but it wasn't like extreme pain. It was, to me, very bearable. So I just, I didn't want to take over what I felt my body needed to recover. So I woke up yesterday morning. I was very, very stiff. My husband had to help me get up, in and out of bed to go to the bathroom. Once I got home and started drinking water, and that was the other thing that I instantly noticed. Like, I don't know if it was just because I hadn't drank water or eaten any food in like 24 hours almost, but food and water tasted different. It was like my body, like the cyst being gone, it just kind of like healed it already. It was almost life-changing. I hate to sound dramatic, but that's how it was for me. Water just felt so good, and I was immediately able to urinate 100 times better. Like, it wasn't like a trickle. I didn't feel pain when I urinated. It was just regular, and I was so thankful for that after not being able to urinate properly, probably for about a year. So that was huge for me. I was so thankful. So like I said, yesterday morning I woke up, I was able to eat, I was able to drink. I did feel pain. I took 600 milligrams of ibuprofen, and I just laid down. They do say that you need to stretch around and walk around. Like, don't overdo it, but stay loose, because that's what helps you heal also, and it keeps the scars from getting like super tight and tearing. It was not difficult. I just kind of walked slow circles around my living room on and off all day. Never felt nauseous anymore. The gas pains I really didn't feel. Like I said, I just centrally located in my stomach is where I felt the tightness. Overall, it was a really good day. Like I said, I think I accidentally, the sweatpants that I was wearing rubbed a little bit on one stitch, so it kind of opened it up a little bit, and it was like bleeding a little bit, but it wasn't terrible. I've kept it clean and dry. It was just like little droplets of blood, nothing major. So I am currently watching that. Obviously today is day 3. I am feeling a whole lot better. I have not taken any ibuprofen today. I feel really, really good. I'm feeling more gas pains. I think it's just overall stiffness from being in the hospital bed. Like, your muscles feel sore just because you're laying there and you're more or less unconscious. So they're doing all kinds of crazy things with your body, and I don't know what they did, but I could tell that they positioned me in weird ways. But so far I feel really good. I have a follow-up appointment this week. I am spotting. They did, initially I think somebody told me you weren't going to bleed after the surgery, but I did, and I expected to. It wasn't a full-blown period, but it was, I would say, heavy spotting. And I'm still even a little bit today, day 3, so, you can expect that, and that's normal. There is cramping. It does kind of feel like I'm on like a small, light period, not like a heavy one, but yeah, so today I am able to move around a little bit more. I'm just not really one to stay down. I'm not going anywhere, but getting up and down, watching TV and stuff, and walking real slow. You will walk like a grandma for a couple days, so, and that's, not the worst thing in the world. I feel bad for anybody who has to do this operation if you have kids to take care of and entertain, because you've got to get up more than once. Thankfully, my husband and I, it's just us and our 2 dogs, so he is able to help take care of the dogs, even though that is mostly my chore, so he has been helping great. But outside of that, overall, it was an incredible experience. I'm going to get pictures next week and see, you know, what it looked like, how the surgery went. I'm trying to think if I've missed anything else. If I have, please feel free to message me. I will answer the best that I can to my knowledge. But overall, the surgery was a success, and I fully recommend that if anybody has a large cyst and they think that it is causing them issues, just get it removed. If you can afford to lose an ovary, I don't remember if I said that. They did have to take the full ovary. I forgot to, I'm sorry. So yeah, the cyst was so large that it was entangled in the ovary. She could not save the ovary. And they also checked the other ovary during the surgery. I had no other cysts, no other complications, no like endometriosis found, anything like that. So, and because my husband and I don't want children, it was not a bad deal for me to just lose one ovary, because you still have a full-blown period because of your other ovary. And she told me that. She was like, everything's just going to switch. You're going to be in full force on that side. No complications should arise from your periods. You really shouldn't feel anything. So yeah, if anybody has any questions, please let me know. I really hope this was informative.